Senator Patrick Brazo helped produce the report, and he knows the issue firsthand.
This is a very personal issue for me, as I have tried to take my life twice. I was hurting, I had given up on everything and everyone around me. But yet, I was fortunate, and I'm fortunate to be here today.
The suicide rate in Canada has remained between 11 and 12 people per 100,000 over the past 20 years. For minority groups such as Indigenous people, that rate can be as much as 25 times higher. Report co-author Senator Ratna Omidvar says suicide prevention programming in Canada has failed.
Since the framework was established, the suicide rate in Canada has not meaningfully changed. There was the slightest of decreases in 2020, which witnesses and experts attributed to pandemic-related supports. But it has otherwise remained stubbornly steady.
Senator Stan Kuchar is another report co-author who is also a trained psychiatrist. He says governments need to focus on what actually works in terms of suicide prevention instead of what might just look good.
From a professional perspective, it was very frustrating to see healthcare systems, whether it be federal, provincial, or territorial, focus attention and investment on things that made people feel good and not on things that actually decreased rates of suicide.
Brazo's struggles with addiction and suicidal thoughts led him to research the issue. He says he found an alarming lack of prevention programming for men.
There are more programs that exist for women than men across Canada. And so this is why in this report it will be important for the federal government going forward to put a gender-based lens on men when we are talking about suicide, because the facts are there, the facts don't lie. Three out of every 4 suicides are committed by men.
The report was produced by the Senate Committee on Social Affairs, Science and Technology. Fraser Needham, APTN National News, Ottawa.
And if you should find yourself experiencing emotional distress and want to talk, you can call the Hope for Wellness helpline at 1-855-242-3310.